We will get through this. We will defeat this pandemic. And to a nation waiting for action, let me be the clearest on this point. Help is on the way.
All right, that help on the way from the president is trying to get 100 million doses out in the next 100 days, actually 98 days now, 2 days into this administration here. Now, many Trump loyalists say that was and remains the plan that he inherited from Donald Trump. Be that as it may, there are some still worrisome signs abroad with spikes in cases. And in the UK, Boris Johnson just detailing to his people that it's going to get worse before it gets better, which, by the way, was the same message that President Biden delivered. Dr. Devi Nampiaparampil joins us right now, physician extraordinaire and all schmutty pants when it comes to this and so much else on the virus. So, Doctor, great to have you back. The idea that it gets worse before it gets better. We had 4,000 plus deaths yesterday. I know people pounce on the 7-day average, which seems to show an improvement. Where do you think we are right now on the virus and the distribution of the vaccines and all of that?
Well, I think that there is a learning curve with all of this. So we are getting better at distributing the vaccine, but there are still significant hurdles. I mean, there are some questions, I think, that should be answered. Obviously, we have a miracle in the form of the vaccine, but some of the major obstacles that I see are the method in which the vaccine is being shipped. So it's being shipped, it has to be in this ultra cold, at least the Pfizer one has to be in this ultra cold container, and it's being shipped in vials of 975 units. So basically, there are minimum orders, and then most of the trays are 975 units, and 6 doses are in each vial. So that means, for example, in a hospital, if you open some of these trays, you have to inject thousands of people within pretty much a day in order for those vials to not go to waste. So that's not feasible at community centers or some of these smaller places or mobile units if you want to try to get to a lot of different people. And then you have the administrative delays of trying to figure out, well, there are only certain people who can be vaccinated because of the priority lists. So I think that's creating a lot of bureaucratic burden in terms of getting the vaccine out, and that's a problem. So one question would be, why does it have to be shipped this way? Why can't there be smaller minimum orders, or why can't people go out and be able to use the vaccine in smaller quantities? So that's one thing. And then I think also, we're looking at it as a medical problem that, we have to get the people to the doctors and the nurses to be able to get vaccinated. But personally, I can say for our private practice, I mean, I'm affiliated with a hospital as well. But for our private practice, we applied to be a vaccine hub to distribute the vaccine. And we're encountering a lot of problems in terms of the IT and communication aspects in terms of the city. Like, for example, you have to register as an immunization site, and there are some technical issues with the website in terms of the registration. So those are things that can create backlogs. I'm not sure about the whole country, but definitely in certain places, I'm sure, where you can have problems with websites, problems reaching people in terms of the phone lines. I mean, for the city, there's one number for both the residents of the city and healthcare providers to use. Everybody's using the same number. And if that voicemail is full, then you can't reach anyone to figure out some of your logistical concerns. So all of that creates a problem.
Doctor, very quickly here, we're learning that these mutated versions of the virus that are popping up in countries, we have a couple of different ones here in our own country, I guess, if I read Dr. Fauci correctly. The vaccine might not be as effective. I could have misread that, but does that worry you?
So it might be. I mean, the coronavirus seems to have the same spike protein, regardless of the mutation. So if the vaccine is effective against that protein, then it should work regardless of the mutation. So there's that. I mean, some of these pharmaceutical companies may have data on this as well, because one of the debates is about whether, why do people still need to wear masks and socially distance or physically distance if they've gotten 2 doses of the vaccine? The question is, well, can you still carry the virus or one of the mutations even if you've been vaccinated, so that you don't get sick, but maybe you still carry the virus? Well, some of these companies may have data about that as well. So, if we can at least have access to that data or analyze that data, then that might answer your question and also answer sort of some of these concerns that people have about, well, once you get vaccinated, can you still be a carrier? And can we get back to normalcy?
Yeah, that's the question. Dr. Devi Nampiaparampil, thank you very, very much. We might hear exactly how the administration plans to address some of the valid points that she just pointed out. Jen Psaki will be speaking momentarily. Stay with us.